Hi everyone, my name is Catherine Byrne. I'm the CPD Officer for Social Care Work. I'm delighted that I actually have the opportunity to talk about recording and evidencing CPD, which I'm sure for many in the room you're going, oh no, more paperwork. In terms of why we should record CPD, CORU under their framework will require that we maintain clear and accurate records of CPD and submit those records for audits of compliance when requested by a registration board. But broader than that, a CPD portfolio provides evidence of undertaking CPD and demonstrates how you keep your skills, your knowledge and your performance up to date of a high quality and relevant to practice. It's also a really useful way over time of providing a record of your career development, which can support you in role or career progression over time. In terms of recording CPD, each of the professional bodies have different templates in terms of how you can record and evidence your CPD to support their members. The HSCP also have a range of templates in support. What I'm going to show you today is CORU's framework, which are optional templates, just because they are common to all of us in the room. So the CPD portfolio refers to the method of how you record your CPD activities. Under CORU's framework, they require you to provide a description of your professional role and practice setting. They require your personal learning plan, which Claire outlined. They also require you to show a CPD log or a record of your CPD activities and to evidence engagement in your CPD activities. So that might be a certificate of attendance at a course or a workshop or a conference. It might be a supervisor's signature on a supervision record. They also require you to have a minimum of 8 reflective practice worksheets, which Sinead outlined. Again, this is what the registration board will request if you are called for audit by a registration board. So in terms of professional role and practice setting, this is a written description of the current professional role and practice setting, your main responsibilities and any specialist areas of work that give, I suppose, the context in which you're engaging in CPD. It's important that you remember that during an audit of your portfolio, a reviewer may not necessarily be familiar with every single aspect of your practice setting or your service users' needs. So it's important that you give that context to them so that they understand why you chose those CPD activities as relevant to your professional role. Ensure that you include the relevant information to enable that assessor to appreciate the CPD activities and how they're linked to enhancing outcomes for your service users. So this is CORU's template. They ask you in 500 words to give that description, to outline your main responsibilities, your specialist area of work and your service users' needs. It is about your learning needs and it's about your work context, and it's important to ensure the confidentiality of service users or your colleagues as well. So this is not about them, it's an overview of the work that you do. Following this then, as Claire outlined, you will develop a personal or professional learning plan. So this is the outcome of your self-directed review of your skills, your knowledge and your practice or your professional practice. Again, and I'm going to emphasise this, and people laugh at me that I keep emphasising this, but we have found that often people actually mistake a learning activity for a learning need. And it's important to differentiate between the two. A learning need is what the skill, knowledge or values you would like to learn or need to learn or enhance. It should inform the learning activity, not the other way around. Again, an assessor will want to see how your learning needs relate to your professional role and meet the needs of your service users and your organisation. Again, that sounds very simple, but if you put down something like flower arranging. Flower arranging is lovely for personal development. However, if you're not going to be using flower arranging in your professional practice, it's not relevant to your role and to your professional development. Does that make sense? Okay. So this is an example again of CORU's personal learning plan. They have outlined, again, coming first, the learning need. Then what is the desired learning outcome, the priority, the learning activity and the time frame. Again, very important here to set yourself a realistic time frame of when you're going to engage in these activities. If you're like me, I am not the most organised person, so if I don't set myself a timetable, things do tend to get pushed to the very last minute. So it's important that it is a continuous cycle of learning. So that time frame piece is quite important. The CPD log then, so this is a record of all the different learning activities in which you engage during a CPD audit cycle. Again, in terms of any advice we can give you, if it's not recorded and evidenced, it must be presumed or assumed that it did not happen. So it is so important that you provide that information in your portfolio. Again, it should be an ongoing, continuous basis throughout that course 2-year CPD audit cycle. Again, credits should be assigned giving careful consideration to the quality of the learning experience and not simply the time that you spent on an activity. So sometimes we attend different training and courses and workshops that haven't provided us maybe with as much enhanced learning or new skills as we would have hoped. Simply assigning the credits based on the time spent in the room doesn't equate to the quality of the learning and how that learning has actually impacted your practice. Again, it's much easier to record these within the CPD log as soon as possible after completing the activity. 2 years is a very long CPD cycle, or a year can be quite a long CPD cycle. It's very easy to forget some of the learning that you have actually participated or engaged in, or to try to go, when did I do that and how did I integrate that into my practice? So incorporate or record that as soon as possible. Again, this is the Chorus template. It outlines the number of the activity, what the title of the CPD activity was, the number of CPD credits assigned to it, when you completed it by, what is the supporting evidence number. So that is the number that you have written on the evidence that you've provided, so that the reviewer can flick to that supporting evidence to show that you've actually engaged in that learning activity. And again, looking at how the learning gained in that activity actually impacted on your professional practice. So usually this is the one that most people are interested in. It's how do I actually assign CPD credits? So approximately the guide that Coru have provided is that 1 CPD credit equals 1 hour of new learning or maintenance or enhancement of skills. So a full day training where you have had new learning or enhanced your existing skills would be approximately 6 CPD credits. So a full day course, maybe 7 hours, but you would minus the time allocated for breaks or for lunch. So it's the time you've actually spent in the conference or learning those new skills or knowledge. Being an active member of a committee, which meets 4 times a year, might equate to 8 CPD credits. Supervision with a focus on reflection through learning from practice might be 1 CPD credit. An informal peer consultation or discussing a work problem with a colleague might be half a CPD credit. So it doesn't always have to come in blocks of 1 hour. There are some times that you might give yourself a point or half a CPD credit for a particular piece that was very, very relevant to your practice. Again, these are just some examples. Under Coru's website and under the CPD framework, there are a range of different examples of how you would actually evidence these learning activities. The formal learning activities, like attending a conference or a workshop, are probably the most simplistic because it is a cert of attendance. Or it is a supervisor's signature or manager's signature saying that they attended that workshop or conference on that particular date. It's the informal CPD activities that are probably, if not more relevant and important to our practice and enhancing how we work and the quality of the work that we do, that are a little bit more challenging in terms of how we evidence them. However, if it was about discussing a work problem with a colleague, maybe it's a critical incident review or a team meeting where you're looking at a particular issue and how to tease it out, you'd identify what the topic was discussed, what the learning that you gained from that, and what impact it had on your professional role. If it's keeping up to date with research and evidence in support of best practice, include details of your research, including journal references, book titles, hyperlinks to web pages, and identify how that research contributed to your professional role. It keeps coming back to its contribution, what it does for you in practice, how it's improved how you work. Membership of your professional network. Again, include details of the networks, the frequency of the meetings, the topics discussed. Indicate contribution to your professional role. I'm going to keep repeating that phrase. And again, gaining and learning from experience. Most of the time it's on-the-job experience that we develop as practitioners and as professionals. So identify what the experience was. Complete a reflective practice worksheet, which Sinead described the process of. And again, identify what, it doesn't always have to be this was a bad experience. It might be that you identified, I did something amazingly well. And I really want to remember how well I did that so that I know the next time I have the skills and confidence and ability to actually replicate that particular action. Again, I'm not going to, I feel I'm repeating quite a lot, but it's sometimes important to highlight these again. Curu required that we include the written reflections on a minimum of 8 different types of CPD activities. And again, this is just a method that shows how undertaking the learning activity met your learning needs, how it impacted on your professional practice, met your service users or your organisation needs, and any area for future development. So again, this is a very, I suppose, this is Curu's template. Each of professional bodies may have different templates or supports to allow you to do this. But this very simply asks you to give a brief description of what the learning experience was, what the learning activity was. It asks you to kind of look at how it met the learning needs. So again, you're linking your CPD plan to your actual learning activities that you've engaged in. Again, on reflection, how has that actually impacted on your professional practice, and identifies if there's other future learning needs that you would like to engage in. There are lots of different supports out there in terms of recording and evidencing CPD. As I said, each of the professional bodies provide either an online or a hard copy CPD recording template which can support you in your individual profession to record and evidence CPD. There are a range of different organisational templates. For example, it may be supervision records or templates that you use, performance management or appraisal templates. Francis would also just highlight HSC Land in the presentation later, which will identify various online tools and supports available through this. And as well, Curu provide optional templates on how to record and evidence CPD. So it's important for you to identify what tools and supports work best for you, but also to ensure that the information that Curu or your registration board are requesting is actually included within your CPD portfolio. So begin by actually looking at what your current recording templates are and ensure that the information is the same, or add in the information that has been looked for by Curu. Look at what organisational templates that you're already using that you would have permission to actually include in your CPD portfolio. Again, try to avoid duplication. We all have enough paperwork to do. I'm sure many people would feel that most of their day sometimes is consumed by the paperwork that goes with our work. So it is important to streamline the information that you're using in your CPD portfolio and to, I suppose, ensure that the duplication is reduced. Begin today. For some I know in the room, social workers, their CPD cycle has already begun. For others, maybe your CPD cycle is already in place through your professional body. And for others still, maybe it's only been introduced through Curu's. But it is really important to actually begin to record and evidence your CPD today. And I say that speaking from our profession, where we've engaged in a range of different consultation processes, where actually it does take practice to become confident and familiar with how to record and evidence your CPD. It is also a sign of professional practice that we are engaging in CPD so that we are demonstrating and able to demonstrate it. If in doubt, if you have any particular queries, concerns, do make use of your profession CPD officer. That's what we're there for. Do make contact with us if you want to look at maybe what your options are or how you can improve or enhance the quality of your recording and evidencing. Again, these are just some of the supports available. I've already highlighted them. As I said, we did say we would take questions. That's me done. I'm sure you'll be glad. I got the boring part, but it's over now.